Hey, I'm Libby Dankman. I'm a journalist, a Pacific Northwesterner, and starting next week, the host of Soundside, a new show about life in the Puget Sound region airing Monday through Thursday at noon. We want Soundside to be a place to meet your neighbors, like a great block party where everyone is invited, or gathering around a campfire to hang on every word of an unpredictable story and then sharing your own. Join the conversation next week at noon right here on KUOW or by searching for Soundside wherever you get your podcasts. Talk soon.
Hey, good morning. It's Patricia Murphy. It's Tuesday. This is Seattle Now. The Omicron variant is spreading quickly, and it's likely there'll be a significant increase in cases over the next couple of weeks. UW Medicine's Dr. Kristin Johnston will give us an update and some perspective on where we're heading. But first, let's get you caught up. The University of Washington plans to resume in-person classes next Monday. The UW was one of the first to start the quarter with most classes online. At the time, the plan was to try and avoid the holiday surge of COVID cases. Now, President Anna Marie Kause is asking students and staff to prepare for disruption as significant numbers of people stay home to isolate or quarantine over the course of the quarter. The school hasn't ruled out returning to remote classes as things evolve. Seattle public school students are back to classes today, one day late. The district extended the break to give teachers, staff, and students the opportunity to get tested for COVID. The lines were long at testing sites run by the district over the weekend, and all testing sites had reached capacity by late afternoon Monday. And in other COVID news, the Seattle Kraken canceled their game against the New York Islanders at Climate Pledge Arena for tonight, and the game against the Ottawa Senators has been postponed by the NHL. No make updates yet. The games are just the latest in a line of postponements for the Seattle team and the rest of the NHL. An uninvited guest marred this year's much-anticipated holiday season. The highly transmissible Omicron variant of coronavirus spread exponentially through communities, including here in King County. As we enter into the first days of the new year and return to work and school, experts say we need to brace for a surge in cases. January is going to be a bumpy month. UW Medicine's Dr. Kristin Johnston is here to give us an update and help clarify what we're dealing with here. Dr. Johnston, good to talk to you again.
Thanks for having me, Patricia.
So Omicron has been in Washington state now for several weeks. Tell me where we're at right now.
Well, the numbers in Seattle, King County are high. They're the highest they've been in the pandemic. Right now, we're averaging about 2,000 cases a day in Seattle, King County. Our previous high was back in December 2020, and that was more like 750 cases a day.
Wow. And we thought that was high.
We thought that was high. And hospitalizations are also increasing over the last week as well. So we definitely are seeing a large amount of community spread here.
Okay, given what you just told me, what should we expect over the next couple of weeks then?
Well, some of the modelers have suggested that we have not yet hit our peak, and so we may be in for more staggering numbers to come, honestly. And I think what we're really going to see is just these widespread disruptions of everyday life, staffing at hospitals, at all facets, from people either having COVID or having exposures to COVID and close contacts.
How should we be thinking about this at this point as parents, as employees, as people have to live their lives? This sounds like we are not winning.
Well, I think in many ways, this is a fast-spreading variant. It is really frustrating. We are, sad to be at this point. But at the same time, we do know what works to prevent the infection. We do know that if we vaccinate, if we boost when we're eligible, that will give us the best chance of either preventing infection and certainly preventing severe infection. We do know that masking is still effective, and we're, really lucky to be in an area where masking is widespread. It's accepted. I think we can double down on our masking and upgrade our masks to surgical masks from cloth masks or even KN95 or N95 masks I know I personally am wearing now KN95 to go to the grocery store, et cetera. We also know that we can stay home if we're sick, protect our community. And we do have testing, although it's not as widespread as we would like or as necessarily available to get the rapid test, for instance. We do have that. So we do have a lot more tools in our toolkit, even as compared to last year.
I want to talk about testing for a minute because it is very difficult right now to get a hold of a rapid test. And we saw all weekend long lines, people waiting to get tested. This is a huge problem that we're having right now because it does two things in my lay mind. We cannot track the virus as effectively, and more people are making these wild decisions because they can't get a hold of a test.
I think it is really unfortunate that the testing is not more widespread. I know it's so hard to get the rapid test right now. I know as well the PCR testing is strained, and I just share your frustration. I guess I wish it wasn't that way. I wish we had a $1 rapid test that was widely available. I also think the rapid tests are really expensive, for people to buy on their own. And, certainly it's just not as available as we'd like.
Testing just seems so key. I feel like we've fallen down on testing, Dr. Johnston, because this is truly the only way we can gauge the spread, especially if what I'm hearing about Omicron is true. A lot of people just do not display symptoms. This happened in my own family.
That's right. I mean, we are seeing many people who are asymptomatic or just have very mild symptoms that are coming up positive. I think we are still fairly fortunate in Seattle, King County that we do have great access to PCR testing, even though it's very strained right now. UW Medicine and UW Virology have provided testing, and they are doing, large numbers of tests every day. But it is not, with this number of cases, it's not meeting the need.
Seattle Public Schools set to return today. UW is planning to resume in-person classes after an extended break until the 10th. What do you think about this? People returning, but a little late.
Well, I am a parent of a Seattle Public School student, and I am very hopeful that they will return. I'm happy that they've tried to make testing available before returning. But again, I think, we know what works. We know from the fall that we were quite successful in preventing cases in the schools. We know that there's masking, there's ventilation. Now all school-age kids can be vaccinated. So I am still very hopeful that the kids can return. Similarly for UW, I'm happy that I think one of the rationales for waiting a week was for people to get back, get tested, and then potentially get boosted if they haven't had a chance yet. So I think, again, we're just maximizing our strategies.
You talked a little bit about moving back to the KN95 mask. How else are you adjusting your behavior, Dr. Johnston?
Well, since Omicron came on the scene, I've been very conservative with my interactions. I really haven't been to any restaurants. I haven't been out and about in that way. I have had very limited in-person gatherings with people who are fully vaccinated and often rapid testing before. Now that's not as possible because of the availability of testing, as we talked about. And then I'm, really thinking through whether I need to go out and do things, even, going to the store, going to other things. I'm kind of going back into that mindset. But at the same time, preserving the ability for our kids to be in school, for our health systems to work. So that's kind of how I'm approaching it.
There have been so many mixed messages about Omicron and how we should respond. It's disrupted everything, and nobody seems to be really on the same page about how to proceed. The CDC changed its quarantine guidelines. That's making some people angry and nervous. How should people be thinking about their personal decisions around their health right now?
Yeah, I think, it's exhausting to go through this risk calculator every time you want to do anything. But, this is where we are. And maybe we're getting good at doing those risk calculations at this point. I think just, really deciding if it's an essential thing. I think right now, doing the things that are essential to you for your mental health, your physical health. I certainly over the holidays did see some elderly family members that I felt like, it was essential to see them. But other, if you don't really need to do it, maybe wait, or, put something off. I do think that the surge, it will go down. We're not going to be going up forever. And so, and based on what's happened in other countries, it does appear to peak and then fall quickly. So, even if we can put things off for a couple of weeks, if they're not essential, that's how I'm approaching things.
Yeah. Okay, let's talk a little bit about boosters because we know they do work. How much protection does a booster offer against Omicron, and how soon after you're boosted can you expect to be protected?
Well, we know from some of the initial studies that the boosters do seem to increase the antibody levels. In terms of how well those antibody levels translate to protection, I think we don't know. But just looking again in Seattle-King County at the public health tracker, it looks like even in the setting of Omicron, cases are 6 times higher among the unvaccinated, hospitalizations 33 times higher, and deaths 45 times higher. For the rates appear even lower for people who are boosted. So, I think I can't give you a number for how much protection it adds, but it does appear to be helping.
Before I let you go, I am curious what you're watching for in terms of Omicron and its impact.
Yeah, I think I am bracing myself for a lot of widespread disruptions over the next few weeks. For our healthcare system, for schools, for stores, all aspects of life. I do think that we are at a very different stage of the pandemic. We have a lot of tools now. Many I've already talked about. We also have, new oral antivirals that are being rolled out. We have monoclonal antibodies, both for treatment and prevention. We have a lot of treatments now as well for patients who are hospitalized. So, I think it will be helpful to see how those are rolled out and what kind of impact they have. And then I'm also, curious to see what happens with the downslope and how quickly that does happen here. And, hoping that we can, in the meantime, get everyone vaccinated, boosted, not just here, but globally, to prevent the next variant from coming.
Scale of 1 to 10, how hopeful are you feeling about 2022 and COVID, Dr. Johnston?
Well, as we talked about for 2021, on this day, I was about a 9 out of 10. Today, I would say I'm at a 4.
Okay. Tempered hope. Got
exactly. So hopefully, for 2023, I'll be back at a 10.
All right. UW Medicine's Dr. Kristin Johnston. Thanks so much.
Thanks, Patricia. Thanks for having me.
Thanks for listening to Seattle Now. Caroline Chamberlain Gomez produced today's show. Matt Jorgensen does our theme music. I'm Patricia Murphy.